Proper ergonomics is an important part of any veterinary practice. Without it, the staff could suffer from injuries such as back problems or joint conditions.
Caitlin, what are you doing? You need a chair. You're going to put your right sit down. Okay. That'll be a lot better. You're really tall, and that's just going to...
Yeah.
That's not good.
Okay, thank you.
You're welcome.
The correct dress attire is a key element to every veterinary practice. Ashley is a new employee and has on many inappropriate attire pieces.
Hey Ashley, I just wanted to point out that you actually have a few things wrong with your outfit today. Your rings and your necklace and your sunglasses and your earrings, the jacket, they all need to go off if you could. I just wanted to let you know too that those can get ripped out by many things like machinery, patients, or our kennels. I also noticed that you are liking some shoes. I would suggest wearing them because they could prevent injury from sharps or large animals. Also, I would also say that you need to pull back your hair just so that it can make it easier for you to work and so that no animals rip it out.
Okay.
And other than that, you should be good. Ready to work.
Ashley is now properly dressed for a day at work and can do a great job saving animals. Keep your back straight and lift with your legs. Use lifting devices like motorized lift tables when available. Get help for large patients or objects. Make sure your path is clear before you begin moving the load. Make sure your footing is firm and you are wearing slip-resistant shoes. Get close to the load before you lift and keep it close to your body as you move. Keep your waist straight as you carry the load. Be aware that patients will sometimes struggle when being lifted, which may cause you to lose your balance.
Come on, Fluffy. Let's get you for your exam. You look kind of heavy. Nah, I got it. Well, you really are heavy.
Caitlin, you're going to hurt your back.
Oh, I
You need to
forgot.
lift with your legs. Do you need some help?
Yes,
I think
please.
it'd
That
be
would
better
be,
if two people get
that'd
on
be
this.
wonderful. Okay. 1, 2. Oh, man. You are a handful.
He is.
All right. Well, thank you for helping.
You're welcome.
Hey, this is Boris. We're doing an exam on him, but he's a biter.
We probably need a muzzle for him.
Probably.
Let me
don't
get
wanna
one.
bitten.
All right, come here, Boris. Ouch! He bit me.
Oh, man.
I'm
I'll hold him, will
bleeding.
you?
If you are ever bitten by an animal in your practice, let your veterinarian or office manager know as soon as possible and take any necessary actions to cleanse your wound.
So, Paige, next time you want to make sure you go from the back so that doesn't happen again. So you go
Okay.
like this, and you always want to go from the back so that the animal doesn't have a chance to bite you. You need to clip it on and tighten it so that there's not a chance of it falling off. Like that.
Okay.
One form of restraint is a catch pole. Many veterinarians opt out of using these in their clinics due to the high risk of hurting the animal. Many animal shelters will use these to capture stray dogs and animals suspected of rabies. Paige and I are using a cat nabber to grab Boris. This is oftentimes used to give vaccines to aggressive cats. Anytime you are mopping in the clinic, always remember to put out the wet floor sign when you're done. Here we see an example of Melissa mopping and forgetting to put the sign out. Let's see what happens.
I'm going to go in this way.
Okay.
Holy crap!
Oh no,
Melissa.
Caitlin, are you okay?
Yeah, I think.
Melissa, I think you forgot the wet floor sign.
I'm so sorry.
That probably could have been prevented.
I'm okay.
The injury could have been prevented if the wet floor sign had been placed after mopping. Isolation. Please Please wear appropriate PPE and take adequate precautions when entering and exiting the room. Here we see Melissa preparing the foot bath with bleach and a towel so that she can enter and exit the isolation room safely. It is highly crucial to always wear the proper PPE when going into an isolation room. If you don't, you run the risk of spreading disease and infection to your healthy patients in the clinic. Here we see Melissa getting ready to go in and take care of a patient. She has already put on her latex gloves to protect her hands. She now puts on her gown to protect her clothing and her body. The gown is made to tighten so that you don't get the back of your clothes exposed to any bacteria. Next are the shoe covers, which protect your shoes so that you don't bring out any bacteria with you when you exit the isolation room. And yes, they are hard to figure out. Next will be a hairnet to protect your hair from gathering any bacteria. And last but not least, a face mask to protect your mouth and nose. Now Melissa is ready to go in and take care of her patient. Here we see Melissa exiting the isolation room after taking care of a patient. She first steps into the foot bath she prepared so that she doesn't spread bacteria to healthy patients. She'll then begin to take off her PPE items and put them in a biohazard trash can that will be sent off for special handling. Always try your best to not let any of your isolation materials touch your skin so that you do not catch any bacteria on yourself as well. This would be your proper container for disposing of your PPE for isolation patients. It consists of a red biohazard bag inside a cardboard box that you would send off along with your other medical waste. Radiation safety is a major part of any clinic. Always be aware of your safety guidelines. Some of the high points include, when able, anesthetize or sedate patients to eliminate the risk involved with retaking x-rays. Always wear your PPE involved with the radiograph machine, and know your hospital's written step-by-step method for operation of the radiograph machine. You can ask your vet for any more specific details. Pregnancy warning. This equipment produces x-ray radiation. If you are pregnant or think you might be, do not use a radiograph machine. Here we see Paige and her colleagues getting ready to do an x-ray on Tigger. Paige is already wearing all of her appropriate PPE items. Ashley and Madison are just arriving and are getting ready to put on their PPE items. First, you have to put on your lead gown, which straps in the front and tightens so that it's a good fit for you. Next is your thyroid shield, which is worn around your neck. Last but not least are the lead gloves. Always be careful when wearing lead gloves as they take away some of your tactile senses, so be very sensitive with your patient. Way to go, ladies. Ashley has just finished giving a patient a shot. She's putting her needle in the biohazard disposal bin, also called the sharps container, where we dispose of scalpel blades and used needles. Some of the major things to remember when handling needles and sharps is to keep them capped until you're ready to use them. Practice a safe method of uncapping them and recapping them, such as the scoop method. Anesthetics are a major part of every veterinary practice. Some of the major things to remember are to know and follow your hospital's anesthesia safety policy, always use the right dosage of anesthetics for the weight of the patient, and check for any leaks before you begin using the anesthesia machine. Here we see Madison getting ready to do an anesthesia leak check before she begins doing a dental.
What are you doing? No, you waft.
Okay.
For any leaks.
Okay.
There you go. Good job. Thank you.
Walk off, but we don't really need that. Anyways, then you just take them away. Come on. Come on.
Walk off into the sunset.
Let me crop a sunset in the background.
I bet she could. Damn, how many peppermint treats you got?
A bunch. It's my face.
Addie.
Oh my gosh. Did y'all see Ashley? No. She's scooping up the cat litter. Oh my gosh. What's wrong with that? She didn't want to hurt the baby. Oh my gosh, why would she do that for her? I don't know. It's me. Oh my gosh, she's coming.
So what plans do y'all have tonight?
I don't know if her setting.
Yeah.
Where's she going?
Ashley, where are you
Wait,
going?
what are you doing? Stop it! What are you doing?
I'm going to take an x-ray.
No!
I want to know how many babies I'm going to have. Is that bad?
Shouldn't you know by now? I don't think you can do that, Ashley.
Well, you're 9 months got to my brain.
You can't
Pregnancy
do this.
brain.
You can't do this.
I can't do this. Okay.
Radiation is bad for your
Go
baby.
sit
down.
Okay. We're good.
Oh no! That hurts so bad. Melissa, why?
This is why you put the
Now
wet
you-
floor sign down while mopping.
I knew you were gonna do that.